it's in the breaking we come unbound. And it's in the giving we are found. Yeah, you could barely change.
Welcome to A Medicinal Mind, Wisdom and Wellbeing, a podcast dedicated to the telling of authentic stories and the sharing of insightful wisdom, exploring science and spirituality, medicine and Mother Nature. No topic is off limits when it comes to growing our personal understanding and supporting our collective well-being. With your host, Dr. Rob Abbott, a family medicine resident practicing spiritually focused and evolutionarily informed functional medicine, we hope to nourish your being so that you can flourish in whatever the moment has called for you to do.
And I know you tried.
In episode 53 of A Medicinal Mind, Wisdom and Wellbeing, I welcome the incredibly talented and voraciously curious physician, expert in the field of environmental toxicity and chronic infections, Dr. Neil Nathan. Dr. Nathan is a board-certified family physician, and as you will hear in the podcast, has an extensive background additionally in the world of pain management. He has spent over 40 years helping individuals recover from complex chronic illness. The depth of his expertise, incorporating multiple healing modalities, is beyond extraordinary, and his determination to continually learn and explore the ways in which his patients can heal is matched by very few. Recently, Dr. Nathan released a groundbreaking New York Times bestselling book, Toxic: Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivities, and Chronic Environmental Illness. And while he is certainly known for his expertise in these domains, his passions and skills as a healer extend far beyond that than just chronic environmental illness. In this discussion, we start off with an exploration of Dr. Nathan's early childhood, hearing about his spiritual upbringing with Orthodox Judaism, and his eventual journey into numerous other spiritual traditions and practices. Distilling down his spiritual core into 3 fundamental mantras: be mindful, be grateful, and be of service, Dr. Nathan provides some tremendous insight into perhaps the ultimate purpose of any religious or spiritual pursuit. Moving from here, Dr. Nathan offers a very personal look into the diverse explosion of his medical education, most of which occurred after his time in medical school. As a self-proclaimed seeker, Dr. Nathan shares the real reason behind his exploration of osteopathy, pain management, and other healing modalities. A true seeker trying to discover the tools that would better support the spiritual well-being of his patients. Expanding into the art of medicine, Dr. Nathan articulates the essence as truly listening and holding space so that the patient can engage positively in the act of storytelling. Dr. Nathan provides incredibly practical insights for any current practitioner or student of the healing arts as to the most supportive ways to listen, collect a history, hold space, remain curious, and engage in the day after day, month after month journey of helping to remove the roadblocks preventing patients from healing. We close the podcast with a critical analysis of functional medicine, as Dr. Nathan helps us to understand how to really discover and address the root causes of illness and not just treat effects with supplements or drugs. Offering wisdom from 40 years of practice, Dr. Nathan shares his observation that as a healer, you will come into contact with fundamentally very different types of patients. Using the terms difficult versus complex or complicated, Dr. Nathan shares a compassionate view towards physicians who feel they are not successful in the practice of medicine, telling us that the most challenging art of medicine is discerning the complex patients who are dedicated to healing no matter how long it takes, versus the difficult or demanding patients who may still have unconscious or other blocks preventing them from progressing in the healing journey. There is a wealth of wisdom in this podcast, and I strongly encourage you to take time to listen to the many insights of Dr. Nathan, as well as check out and buy his book, Toxic. And with that, let's dig into the show. Well, Neil, thank you so much for joining me. I think this is, third time the charm for scheduling to be able to get this to work. But I'm just really, really excited to have a conversation with you. I have tons of questions, and hopefully we can delve into some different areas of your background. So thank you for joining me.
Yeah, great. Thank you for having me.
I really have loved starting these podcasts rather than delving into who you are maybe on paper, as a physician with a lot of expertise in certain areas. I found that I love starting these conversations more with exploring the spiritual background of the interviewee's childhood and just really getting into what was that life like for you as a kid. I see it gives us a great insight, in my opinion, into the story that kind of unfolded in your life and the direction that you went. So I would love if you'd love to share a little bit of your background, perhaps within that spiritual realm or maybe more scientific realm as a child.
Sure. Actually, that's the first time anyone's ever asked me that. And I really think it's a wonderful question. I don't know if anyone will care for the answer, but I think it's a great question. So I'm tempted to do the old Bill Cosby line, I started as a child. But to be more specific, my official spiritual background was Judaism. My grandparents were Orthodox Jews, and my parents then moved to conservative Judaism. And so I was raised in that kind of a religious environment. I went to temple pretty much every Saturday and participated. And also went to Hebrew school, studied and learned that. So that was my official background. I would also say that even learning it didn't completely resonate for me.
Yeah.
Meaning I would read stories of the Old Testament in which that God was often a vengeful or angry God.
Yeah.
And that didn't really resonate for me even as a child. My sense of God, however that came to me, was way more benevolent than that. So even growing up with that spiritual background, which I studied and embraced, that wasn't sufficient for me spiritually. I found a lot more connection in nature.
Yeah.
And as a child, spent a lot of time outdoors. And as an adult and young adult, did a ton of hiking, camping, fishing, canoeing. That resonated for me a lot more. And over the years, I studied virtually every spiritual discipline that you can think of, with a variety of responses, resonating perhaps more to Buddhist philosophy than I did to others. But after a while, even doing a lot of disciplines, for example, I've studied Vipassana meditation for 25 years. I've studied Tai Chi and still practice for almost 40 years.
Wow.
I've kind of distilled my own personal spiritual belief as to how one should live into three very simple precepts, which is be mindful, be grateful, and be of service. And to be honest, it takes, a full day's mindful activity to just do that.
Yeah.
Without adding any other frills or any other components to it. So, that's kind of what I've come to. Am I kind of answering your question?
Yes. No, I love that distillation. Be mindful, be grateful, and be of service. And I think it's easy for us to, myself, I resonate with everything you said, going through life, looking at different spiritual traditions and really resonating with different aspects and kind of recognizing that there's a much bigger picture than just saying, I'm a Christian, or I'm a Buddhist, or I'm, a Hindu, and recognizing the beauty and really unity of all of these traditions. And at the core of really everything is what you're getting at. And I think we get distracted sometimes with the frills and whatever else you want to call it. Some of the ceremonies and things sometimes can take us away from what really is this purpose. It's a purpose to, I think, connect with something greater and connect with other human beings in that same vein who have come from perhaps that creator. And I don't know, it really resonated with me, and it's just beautiful to see. I also kind of make parallels, and perhaps you can provide some insight on this, on how that's informed your medical practice. I think a lot of us in this integrative space are ones that are obviously going a different route. So, whether it's choosing to do different types of lab tests, approaching treatment in a very different way, whatever it is, speaking kind of vaguely here, but in the integrative space, we're sort of walking a different road, but incorporating different practices amidst a strong foundation of principles, kind of like be grateful, be of service, being mindful. And no matter who you talk to in this space, they're going to have similar principles that are going to be very foundational to any approach. So I was curious, do you feel like that sort of, for your spiritual nature, kind of being exploratory and delving in different practices, was related to or informed what you eventually did in your medical practice?
Well, I think they're connected by the thread of curiosity or seeking. I mean, most people would categorize me as a seeker in the sense of never being satisfied with what I know and always feeling a need to learn more so that I could be more helpful to the people that I'm attempting to serve. And I think that's kind of characterized my whole life. I mean, I went to medical school wanting to be a healer, and I didn't know that wasn't how medical school worked. They were going to teach me to be a medical technician.
Yes.
And that was a kind of a stunning revelation. I was so naive that I thought that that's what I was going to learn. Fortunately, I did have one particular teacher in medical school, and that was Elizabeth Kubler-Ross, who had a fabulous class in which we huddled behind. Back then, they didn't have cameras or anything. It was one of those two-way mirror things where she's with a patient in one room, and a bunch of us are sitting crammed into a little room behind it.
Yeah.
Watching her. And so for 4 years, I had the luxury of watching her talk to patients, elicit a history, and she was a uniquely spiritual being in that she conveyed how much she cared to patients with her presence.
Yeah.
And watching her work probably was really formative in terms of my looking at her way of doing a history and physical and talking to patients and going, that's how I want to do it.
Yeah.
I want to connect with people on the level that she is, so they will be comfortable sharing with me their story, so I can get the information from them that I need to help them. And so that was the start of it. And as I left medical school, I interned at San Francisco General Hospital, then went into the Indian Health Service. And it became clear to me that what I learned in medical school wasn't really adequate to help patients to the degree I wanted to help them.
Yes.
Great information for lots, but it just wasn't comprehensive enough for me. And so I plunged into studying with anybody who I thought had anything to offer in terms of healing.
Yes.
In the first year that I left, I studied therapeutic touch with Dolores Krieger, and I studied acupuncture. I studied homeopathy. I plunged into osteopathic manipulation, particularly cranial work with the Cranial Academy. I learned emotional release techniques. I'd already learned hypnosis in medical school, and I can go on and on and on from that. But everything that I learned was a piece of this big puzzle that I was looking to fill in for myself, which is, how do I understand my patient's spiritual needs and relate to them? How do I understand their emotional history and how that informs where they are? And how do I understand them physically? I mean, I had basically been a biochemist before I left for medical school. So biochemistry and anatomy, to me, were the underpinning of what I wanted to work on. So, I basically passionately studied all of this in an attempt to sort of integrate it. And I would like to think that my current work in teaching and helping people is the distillation of all of that effort. My first couple of books were really a very good introduction to patients and physicians for what functional medicine is. Yeah. And my new book, Toxic, how healing your body from mold, toxicity, Lyme, multiple chemical sensitivities, has grown out of, because of my interest in helping people. Over the years, other physicians began to refer to me the people that they didn't know what to do with.
Yeah.
and that began early with largely in the field of pain, where my background in acupuncture and osteopathy and homeopathy, manipulative medicine, allowed me to offer people with pain more tools to figure out the cause of what their pain was. And I was able to help a lot of people that other people weren't. And early on in the pain management field, I took on running a hospital-based pain unit. And so I've got like a 30-year background in that. That led to starting to work with people with fibromyalgia and chronic fatigue. And that led to all of the newly understood causes for chronic fatigue and fibromyalgia, which is where I am kind of now.
Yeah, that's certainly opening Pandora's box, to say the least. When someone comes in with a diagnosis, the label of chronic fatigue and fibromyalgia, you have no idea from a functional perspective what you could be getting into. And so I totally imagine and can totally see how when that door opened, that suddenly there was probably a huge amount of things that you were just like, what in the world? What are the underpinnings here? And I mean, that's a tremendous background. And I'm just sitting here, and I've had, luckily, some, I think, very keen wisdom bestowed upon me about, I've had that same sort of passion. It's like, I want to do this, I want to do this, I want to do this. And I've done some early training in yoga therapy. I've really been active in a mindfulness community and my medical school and the nursing school associated with us. And, I see all these things, and you want to learn more, do more. And having to sort of pause and say, I don't have to be the technician or the practitioner of those arts. I want to have a conceptual understanding, and I can build a community. Otherwise, I'm going to be in school for another 20 years and then, finally, start maybe helping somebody. And so, like, being able to... Yes, well, that is true. Maybe in a very practical sense, being in school for too long if I were to pursue that, formally. But basically, that realizing that really at the essence is what you just said. How can I learn to hold a space for this individual to understand their emotional and spiritual needs? And I mean, you can read about it conceptually in textbooks and with folks that have some really beautiful writing. I've really resonated with Rachel Naomi Remen and some of her writing and some of the stories she articulates with patients that really has helped inform me about how to try to attempt to hold that space and enter into that relationship. But really, it comes down to both having it seems that you had was a beautiful mentor to observe. And I think a lot of times in medical school we want to learn the elements of the physical exam or learn the elements of the history in a textbook, but what we really need to do is sit down and watch someone who really can hold that space. And I see that now, just as you kind of were alluding to, is that's the art, right? That's the craft, is holding that space so you can collect the information to integrate something for yourself, but integrate an experience for this individual so that you can better help them. I mean, that's the art in the craft. I mean, the other pieces are sort of acquiring the knowledge, the ideas about what might be going on, but really that space. And so I've become a huge seeker, kind of like yourself, on how do I go about becoming a better physician to hold that space. And I don't know, I'm really resonating sort of hearing you describe it, because it struck me in medical school, and it took me really away from the biochemistry and took me more to the spiritual realms, the emotional realms, the connection with mindfulness. And
unfortunately, Rob, what you've probably discovered is medical school doesn't usually have people who can teach that art.
Yes.
Because they're focused on having a time frame in which they can work. And the HMO managed care model that took over about 30 years ago is horrible for giving someone the time to spend with an individual, to listen to their story and really listen, because what you're really talking about is listening.
Yes.
And bringing to listening a real openness and curiosity, which you convey to that patient, which is, I really want to help you. I really want to listen to your story. And if you have your back turned to them typing into a computer, you cannot give that message. If you are looking at your watch because you have 15 minutes for this visit and you're at 13 and the patient hasn't even warmed up into their story yet, there's no way that you can help the kind of complicated patients that we work with. So you need to find a way to create a structure in which you can listen. Time is not an issue. You're simply there with that person, and there's nothing in this world but wanting them to be able to tell their story, because in that story are all the clues you need to make that diagnosis. We're taught in medical school that 90% of the diagnosis is made by history. And so listening to it briefly and then running out and getting lab tests and x-rays and MRIs is actually not the way to do that, because now you're just working in legal medicine and you haven't even listened to tease out, well, what tests would really be helpful to this person. You're just kind of getting rid of them until you can bring them back to spend another 7 minutes with them, going over the tests that you ordered prematurely because you still haven't listened to what they're saying.
Yeah. It's so true. And what you said, I have a lot of compassion for certain physicians within that structure who want to be listeners, but it's impossible to do it when you have such a limited time period. And so it makes sense that you're going to interrupt someone within 15 seconds if they haven't told you the immediate thing that you want to know. And what you think you want to know. I think all of this comes, and there's many terms mindful listening is kind of maybe an overused term, but I sort of see it as informed listening. A lot of what we do in this space is asking the right questions and utilizing intake questionnaires. I don't want to obviously overwhelm people by giving them things that take 3 hours to do. But if you have a very precise intake questionnaire that someone fills out that you spend time reviewing before you speak with them, I found anyway that you can be a much more informed listener, and you'll still spend that time with them, or as they articulate their story. But it's how you gather information. And I've never really found anyone who complains about spending too much time describing their health. Yes, they're always going to be there, but I sort of starting to see it now as this informed listening where you're so fully present that you're right, time doesn't matter. You're so present that you kind of even forget about the time, and whatever needs to occur in that space is going to occur, whether that it's time permitting or not. So I don't know. I know we kind of rambled off into the spiritual and sort of somewhat esoteric, but I've just really, I don't know, this is a lot of fun for me. So I don't know if you had any reflections before I kind of segue into maybe something else. But
well, we'll segue. I would have a different view of that,
Okay.
which is, I think anything that confines the patient's story potentially limits what they think they want you to know and the way they tell their story.
Okay.
So even though I do have a patient questionnaire, I don't look at it until I've talked to them first.
Interesting. Okay.
I want to enter that room with zero biases about what I think they have. If I review their story, I've already formulated thoughts about what they probably have and the direction I probably want to take it.
Correct.
And I would suggest that if I put no limits on what the patient wants to tell me, and they can tell me their story their way without a preconceived idea of what they think they want to know, because patients will do that. If they think I want something, they will try to please me by telling me that.
Yes. Yeah.
And I don't want that, because I found that often that leaves out pieces that maybe they thought were important, but that you clearly don't. So they think I'm not going to go there quite yet.
Mm-hmm.
So I'm more into a much more open-ended process, if you will.
Yeah. No, I totally resonate with that. I could see, maybe I should just start doing that next week and give it a shot. And so I can totally see where you would go into it. All right, you haven't read anything. You don't know who this person is.
Right. Try both.
Yeah.
And see where that goes.
Yeah. No, I love that. I mean, I did a little bit of that in medical school with some of the standardized patients and things. Sometimes I just walk in there and be like, all right, they wouldn't even really give you that much information, just like minimal stuff anyway. But you just walk in there and all right, what's going on? And just really sort of getting to the story with having as little of a bias as you possibly can. Well, with all that being said, you've heard a lot of patients' stories in your lifetime as a physician, and actually I feel like that's one of the things that perhaps people reading your book might overlook is actually some of these other aspects beyond just the amazingly practical and sort of very precise medicine, in air quotes, that you're practicing. So you've been with quite a few patients and held quite a few spaces, but would love to get your sort of description of what would you call yourself? I know maybe on paper you're a physician, but you entered into a realm of sort of environmental medicine, and you alluded to chronic mold and some other toxicities, and you use the term toxic, but would really love to get your definition of who you are and kind of get us in this snowball of perhaps the toxic world.
I would have two answers to that question. First of all, I would say I'm a medical detective. Second, I would say I would have, what I'm about to say, I would have said was presumptuous a few years ago, but I think I need to own it, which is I think I'm a healer.
Yeah.
And so not in an ego-driven way, but when I enter the room with a patient for every visit, because it's different, my overriding question is, what does that being need from me today? Is it tweaking their biochemistry? Is it tweaking their treatment program? Is it to talk about something that is stressing them out? Is it a spiritual crisis that they're having? Is it an emotional issue that they're having? In the complicated world that I work, there are so many roadblocks to moving forward that the patient will tell me what their immediate roadblock is if I'm listening. So I don't come into any visit with an agenda. I come in, maybe my agenda is simply, what should I be doing today?
Discover the primary roadblock.
Right. What do you want from me today? And typically a patient will consciously or unconsciously or subconsciously share that with me as they begin to talk and tell me what's really going on. So what I do with the patient on any given day will vary enormously. Sometimes it's nothing but what you would call a pep talk. People who are so frustrated with having made no progress that I just need to keep them enthusiastic and optimistic that healing is indeed possible for them. And for other times, it's a therapy session. And for other times, it's a spiritual exploration. And sometimes it's going over everything they're taking, every supplement, every medication, and going, okay, do you really need that now? Or do we need to add something to this to make this better? And so the work that we do is pretty complicated, and it requires patience, attention to detail, and a constant, the word I use for it is tweaking of what are we doing in what arena, but there's no set plan to it, if you will. The plan is patient-driven, and I would submit to you it needs to be.
Yeah. I, once again, love everything you've just described and resonate with what you just said. I feel like, again, all of those types of conversations are things that we're having as physicians, or can have, if you have that sort of open perspective to it. Some of them may seem like, I didn't train for that in medical school, and the reality is, yes, you didn't. You didn't really train for that.
Yeah, I should add that I can say this with a great deal of comfort, but for young doctors starting out, it's really easy to say, well, I don't have any training in this and that and this and that. And well, neither did I when I started. All of this is you're seeing the end result of 47 years of passionate, intense study and training. Moving into different arenas as I felt I need more training in how to work with emotions and psychology, or I need more spiritual understanding of what I need to work with. I need to understand every spiritual approach so that I can work with that individual from their spiritual background, not opposing what I know, but where are you coming from so I can flow into it, if you will, and let them work from where they're coming from. So for young doctors, it's purely, if you want to be a healer, this is a lifelong adventure. Don't get too worried about what you can't do. Be who you are in that room with that person, with what you know, and you'll learn. Most of what I learned was taught to me by my patients, not from what I learned in medical school. They are your teachers. So don't worry about what you don't know. That'll come along. It's if your intention is to be in sync with what your patient needs, you'll do okay. In fact, you'll do better than okay.
When I was first preparing for this conversation, I was ready to get absolutely geeky in the world of mold and its fairly complex testing, pathways, and treatment protocols. What I found shortly into this podcast, however, was that the moment, this particular space, was not asking for ADH, MSH, and cholestyramine. What it called for was genuine presence, encouraged to push deeper into the spiritual roots that make healing from any chronic disease actually possible. As we continued deeper and deeper into this therapeutic art, I was finding myself seeing Dr. Nathan more akin to a priest, a rabbi, a shaman, and a visionary than a medical doctor, technician, or expert in pathophysiology. For anyone listening, and I know I have quite a, there's an audience of folks my age. I know I've gotten tons of messages and phone calls from people exploring and like, hey, how do I, should I go to medical school? I already know I want to be this sort of more holistic, integrative healer and these things. So for anybody listening, within these realms, it actually really doesn't matter what age you are. That was just such another wonderful piece of wisdom. And it's a great piece of encouragement for me, sort of at this young age. But I think it's just encouragement for all of us within this space to recognize that we don't have to be intimidated by what we don't know. And if we really just put our intention to holding that space and to being present with our patient and being open to what they say, I think the biggest roadblock for a lot of physicians is the paternalistic mindset of, I know what's best and I know what's going on and I know what needs to occur in this visit. And I don't know, I really, really appreciate those insights. And
there's a one of my favorite sayings in this context is by Suzuki Roshi, who says, "You are perfect already as you are, and there is room for improvement."
Oh, wow. Man, that's beautiful and so remarkably true.
Yes.
Well, goodness. I almost, I tried to segue away earlier, and I almost don't even want to segue away from these, this type of discussion. But people probably listening who've heard you, or perhaps waiting to hear, what's some old toxin guy going to talk about? No toxins. So
you see, people think of me that way.
I know.
but I don't think of myself that way.
Of course you don't. There's no, yeah.
I am so much more than the mold toxin guy.
Yeah.
Forgive me, I don't mean it in an egotistical way. That's something that I have studied that is of particular interest to a lot of people now, and that's something that a lot of people want to hear about.
Yes.
But when I walk into a room, I don't walk in with, you've probably got mold toxicity because that's why you're here.
Yes.
I walk into the room with, I have no idea what you have, and let's see if we can sort through all of the details of your history and laboratory work and figure out what you've got going on here. True, most people seek me these days because of my expertise in mold and Lyme. Yeah, that's true. But often I'll hear a story and go, I don't think that's mold. So just because you're in my room doesn't mean you have mold. It's merely an opportunity for me to look at this in the most expansive way as I can to, okay, what would explain this person's symptoms the best? And where should we be looking at that? So, and I think that's important, labeling someone, including me, isn't really helpful to anybody. And I just smile at it because it's like, really? Okay.
Yeah. No, it's so true. And I think, we get, caught up with, there's so many terms you can call it, labels, judgments, experts of fill in the blank. It's easy to get stuck and pigeonholed in a certain area. And, yes, of course, like that's an area you've spent some time, and people are going to, seek you for that. And I think you've just even further elucidated how you seek to enter that space without having that bias as much as you can, right? You're to some degree, people are going to be seeking you out for those things, but how can I try to enter that space and listen and maybe hear that, okay, that doesn't sound at all like that's really the core of what's going on for you.
Right. And one of the core issues that I attempt to address, certainly in my new book, is what I will call critical thinking skills, which is one of the things I've observed in the burgeoning new field of what we call functional medicine.
Yes.
Is that a lot of docs have learned a whole lot of tests that they can do to help figure out people who are complicated.
Yes.
And what I watch them not doing is applying critical thinking skills to the information they get on those tests. So I'm watching people get information back, say they have a positive Epstein-Barr viral titer, or their methylation genetics doesn't look very good. I've watched people who are starting in this field plunge into, that's the cause of your illness, and we're going to treat methylation, and we're going to treat your virus.
Yeah.
And they often don't take a step back and ask the question, which to me is central. Would that, under any circumstances, explain all or most of the symptoms that this person is giving you?
Yeah.
And I would submit to you that the answer is usually not.
Yeah.
That I see a lot of referrals from doctors who've treated a number of functional medicine issues for several years and have made very little progress, and they're baffled. And that's because they haven't asked the central, absolutely most important question: what would explain this person's symptoms?
Yeah.
And forgive me, but that is so, you would think, basic, and yet the overwhelming amount of information that people now have on their tests,
Yes.
I think, is getting them confused about the forest and trees.
Yes.
Is not coming back to, great, I've got all this information. Which pieces are most useful for the person that I'm looking at? Or do I still need to look deeper? And if I can segue into the mold and Lyme world, many of the people that I see have very, very, very complicated symptoms. So complicated that the doctors that they've seen have often said, this is in your head, because nobody could have all of this. And it's not in their head. But we're looking at fatigue, cognitive difficulties with focus, memory, concentration, and brain fog. We're dealing with anxiety, depression, depersonalization. We're dealing with a wide variety of pain: joint pain, muscle pain, nerve pain. We're dealing with increased sensitivity to sound, light, touch, chemicals, and food. We're dealing with all the gastrointestinal symptoms you could imagine. And there are more. So given this long, complicated description, it behooves us to go, okay, this being is really suffering. They've got a lot of stuff going on. Where do we start? And one of the areas that a lot of conventional doctors have not learned much about and that are controversial are Lyme with its co-infections and mold. And generally, when you get a patient with that complicated a story, that's what you want to be starting to look at. Not methylation, not adrenal, not gut physiology. Are all of those involved in the pathological process? Yes, they are. But they are downstream to the cause. And if you treat that, you can treat that till the cows come home, and patients will only get a little better. Because another pearl, if you will, is if your patient is not responding to what you're doing in a reasonable period of time, go back to the drawing board. Ask the question again: what could cause these symptoms? And so, I mean, that's what my book was partly written for, Rob, was to really educate both patients in terms of what they ought to be looking for, because we live in a world now that many patients are very well educated.
Yes.
Often they will be bringing to their physician, if that physician is open to it, a world of, I've been looking at this for a couple of years and researching it, doctor, and this is what I think is going on. And if the doctor doesn't get their ego involved and saying, I'm the doctor, I'll figure it out, and go, great, you've done all this research for me, let me at least listen to you. If we can honor what our patients are bringing to us, they'll often be telling us a lot about what we want to be looking at. So my new book, Toxic, is really partly about that, which is really giving both consumers and physicians a model to work with, both for diagnosis, and then there's a whole separate section of the book which I call Rebooting, in which how do we approach treating that, because our old model of simply, okay, you're deficient in thyroid, I'll give you a little thyroid and you will be well. That works great for someone who's not complicated and has a simple thyroid problem. For someone who's got all of this other stuff going on, it's a drop in the bucket. And And medicine needs to begin to think not as a single cause and effect, but in multivariate, complex problem-solving models, because our old model is simply inadequate for the things we're looking at right now.
Yeah, no, I agree. And I was just reading an article the other day, right, that says artificial intelligence is going to eventually replace the medical technician. It's not going to replace, however, what you've described as this multi-dynamic healer with the ability to discern in any moment and provide that human connection. That is never going to be taken over by, I'm making a huge statement, but that can't be replaced, as I can see it in this moment, by any kind of artificial intelligence computer. We can build some tremendously amazing artificial intelligence that be able to look at these multiple systems and these complicated networks and things, and be able to provide perhaps more insight than maybe we can look into. But when it comes to that sort of multi-dynamic healer, that's not going to be replaced. And so perhaps we should put more energy ourselves to be that healer rather than the medical technician. I don't know. I'd rather not spend the rest of my life doing something that a computer learns, how to do, and it's doing better in 10 years. That would be kind of disappointing. So,
right. And there's two. A, I agree with you. B, there's two issues that, as you're speaking, I'm thinking about. First, as brilliant as an artificial intelligence may be, I'm not sure that it can take in the energetic of what a patient says.
Correct.
I'll give you an example of that. One of the hallmarks of the co-infection Bartonella is the way in which a patient describes their symptoms. And what they will often say is, Doc, I feel this burning electrical sensation in this part of my brain, and it's moving across to here. And you can write that on a piece of paper, but the way they describe it, the intensity of that description, that's a Bartonella description.
Yeah.
So when I hear someone describe it, I already have a pretty good idea of what they have. I don't know if a computer can do that.
Yeah.
Maybe eventually, as computers can even read emotional info, perhaps, maybe.
Yeah.
The second part of it is all of the algorithms that the artificial intelligence gets has a political component to it, which is the concept of chronic Lyme disease and mold toxicity are new to medicine and very controversial.
Yes.
So who builds the algorithm? If that person does not believe in chronic Lyme disease, it won't even be on the algorithm.
Mm-hmm.
If that person doesn't know anything about mold toxicity, there will not be on the algorithm. And so you can take this wonderful history, and two of the major diagnostic possibilities won't be there unless politically this becomes accepted into medical practice, which it is not right now.
That's a very true point. And we could open up a whole, can of just, like you said, controversy is probably the easiest way to put it in terms of that realm. And, I've certainly as a young physician, met a lot of people who are adamant, right, that those things just cannot exist, do not exist. And it's almost like a way of just disregarding the complicated patient's story. I sort of see this, whether you know exactly what's going on, and we're sort of saying here that it's so multifactorial, really at the essence, you may not find one single thing, but if you can't explain some, complicated patient's story, don't just completely disregard it because you feel like it's not that or that doesn't exist, and that's a whole other area. And I did want to sort of, back, you were talking a little bit earlier about trying to understand, what the patient wanted in that visit, or really trying to get at what really is the root of this, at the root of this person's symptoms or experience. And I will give an example in my residency clinic. I had a woman come in, and she had a Western blot test, or she had multiple Western blot tests for Lyme, and had been repeatedly on multiple different types of treatment. And her last one, essentially everything was positive, except for like one IgM band. And she comes in and she's like, my doctor said I'm going to have to do IV antibiotics because this is like the worst case of Lyme she's ever seen. And I was like, okay, well, what are your symptoms? And, we start to talk, and she's one of the most functional people I've ever heard. And I'm like listening, and I'm just like, I can't see how, IV therapy would be a good, IV antibiotics is a good thing. You seem like you're doing really well. And actually, if I make any sort of comments to areas that you might need to work on are probably not related at all to what they're saying. And it was just like, and then she left, and I didn't hear back from her for quite a long time. And I think, it was, all she wanted to hear was, I don't need to do IV antibiotics, which, for me, it seemed like so obvious. It's like, here's a person who's super functional, and here's a test that says like, oh my gosh, you're like super toxic with Lyme. And it just, I don't know, maybe it's a good example of that. So if you order all these tests and then you don't put the critical thinking in, like, that seems ridiculous to me. Why would you do that if this person's like completely normal? They're not actually a complicated patient with 8,000 symptoms. So that was just one thing that came to mind for me. I'm sure you have probably plenty, as you were alluding to, plenty experiences like that.
We don't want to treat pieces of paper, meaning lab reports. A piece of paper has information, but that information has to be put in the context of that person's life. And so you're giving a very good example of her symptoms didn't fit the piece of paper.
Yeah.
Now, it's actually a very good example because there's a whole lot of ethical considerations here. You can have Lyme disease and still be functional. So, did she really have Lyme disease? Well, our testing isn't perfect, so maybe yes, maybe no. By symptom, she didn't. By piece of paper, she did. Could it be possible that some of those symptoms will show up eventually, and then we might come back to this later and go, maybe we should have treated it? Not with IV antibiotics, by the way, but because I agree, that's overkill for the situation you're describing. I don't love simplicity. I love complexity. So I'm going to make your story a little more complicated.
I love it.
You also want ethically to be sure that you're not doing wrong by that patient by not offering them the possibility of treatment. What you did was absolutely correct in making it clear to them, your symptoms don't match the diagnosis on this piece of paper. But having seen several thousand people with Lyme disease, human beings have a very bad habit of being totally unpredictable and completely biochemically and genetically varied.
Yes.
How they present to us. So, I hear that and I go, totally understand what you did, and it's completely understandable. And I'll leave that dangling.
Yeah.
Just for fun.
Yeah. Well, I think, and it shows, like, in these situations, it is so complex. And I've had a few conversations before where I've tried to sort of compare and contrast what I see as complicated and what I see as complex. Complicated, really, how I've described it, is a system that it can have a gazillion moving parts, but you can still describe that system. A complex system is one that is so infinitely complex that if you tried to it's like an engine, if you tried to rebuild it or something in some fashion from a plan, you wouldn't be able to do it. So I see, I sort of see the human organism actually as this amazing complex system within the greater sort of universe. But, I love and sort of contrast that with the description you had at the end of the book, and you've alluded to pieces of this in the podcast of a complicated patient versus a difficult patient, and being able to discern really who is a complicated patient and who's a difficult patient, because in your terms, and you can maybe explain to us why that matters a lot, seeing that difference. And so maybe you can explain for people, what do you see as a complicated patient versus a difficult patient?
That's a very, very good question. And I promise you'll spend the rest of your practice career attempting to answer it.
Yes.
I've wrestled with this for a long time, and I'll introduce it from one of the most difficult things for me to understand when I started working with patients was at a certain point in treatment, I began to recognize that there was a critical point where that patient was getting better and had a decision to make about whether they wanted to keep getting better. And we're talking complicated patients here, not simple. And I would watch patients sometimes sabotage their own treatment and go backwards. And I would they would be doing great, and then they would stop treatment, as an example. Or they'd be really moving along, and then they would do some physical work that they knew would re-aggravate their back pain, say, and bring it all right back.
Yeah.
And you'd watch that. And for me as a young physician, very idealistic, it would be, well, everyone wants to get well. And what am I looking at here? And absolutely baffled me. Did not understand it. It was, let me get this straight. You have a choice of getting well and not getting well, and you're choosing not getting well? Couldn't make heads or hair of it. It was not in my training. No one ever taught me anything about that. And over the years, I've seen a fair number of those patients. To me, that's fascinating because it raises all kinds of questions, which is this conscious, subconscious, or intentional? Very hard to know. Often, I would attempt to discuss this with the patient, and more often than not, it's met with absolute denial. Like, what are you talking about?
Extreme defense.
Yeah. Of course I want to get well. Then why are you doing A, B, and C? And then they would look at me blankly like, well, I don't know why I'm doing A, B, and C. So a physician is faced with, I'm sorry, do you want to get well or not get well? If it's unconscious, do you want me to bring it to consciousness, or am I hurting you by bringing to consciousness something you have no intention of getting there? Am I going against what you want? Is this something that bespeaks old trauma, PTSD type events, old abuse, old ways in which you were treated, that you have a stuck place here and you are not yet ready to think about it or talk about it or deal with it? Am I harming you by even asking you to consider this because I'm not on your time framework? Maybe that's not what you need to be doing. Maybe who I am is the wrong energetic person for you to be dealing with. Maybe I'm not the right doc for you. Maybe you need someone who can understand this better in your own context, because I'm not. And maybe we need to refer you to someone else. So maybe I'm. And so these are really super important questions. I've wrestled with, these are my most burning questions with any patient who's not improving, which is this something I don't know? Is there some information I need to be learned? Am I the wrong doc for this person? Or does this person, for whatever reason, not want to get well? And I don't mean that in a pejorative way. I mean it, they're on a being level, they're not ready. They've got some other life experiences that they need to have first. And those are what we wrestle with when we talk about difficult persons versus patients who don't want to heal. So a difficult patient is simply someone who's complicated. If they are motivated to get well, I'm happy to work with them. I don't care how complicated it is. I'll see it through to the end. And I've worked with people for 7, 10, 15 years until they finally got to where they needed to get well. And often I have a sense about people when I start with them that I know you're going to be complicated. I know we're going to be seeing each other for a long time. But somewhere in my heart, I know that you really want to get well and that you'll get there eventually when we figure it out.
Yeah.
But I have another feeling with other patients where I don't have that certainty. I'm working with them and I have this sense, and I don't know how else to put it. I don't think you're going to get well under my care. So attempting to define those patients, I think, is very helpful for physicians, especially young doctors, to begin to wrestle with these questions, because you will be wrestling with these questions forever. They don't go away. And I have a number of patients that I'm that I see or consult with where they have certain qualities that make me less eager to take them on as a patient.
Yes.
If they are overly demanding, overly needy, if they won't own their own experiences, particularly, I will talk about cognitive. There's most of the people that I treat who have mold or Lyme or things of that nature have some degree of cognitive impairment. Brain fog, difficulty with focus, memory, concentration. I can always work with patients who will say, oh, I missed my appointment. I think that was my fault. I spaced it out or forgot it. Or I think I forgot to ask you for this or that or the other. What I can't deal with is patients who don't own that cognitive difficulty, and then they blame my staff for it. And forgive me, I'm really protective with my staff. They work very hard, long hours. It's difficult work. The last thing they need is somebody accusing them of mistreating them or not doing what they were told to do when the patient played a role in that.
Yeah.
And for me, if a patient won't own that, I don't want them as a patient. I am very sorry that you have what you have, but I can't abide any reason to treat my staff badly or berate them or chew them out. Or they're loving people who really are doing their best. And if you can't see that, I don't think we can have a relationship. Yeah. So am I answering your question, Bob?
You certainly are. And I mean, this entire conversation has been, I guess I had no idea where we were going to go in this conversation. I had some maybe preconceived notions. But where we've gone, I think, has been tremendous. And you've really hit on some areas that I think are incredibly enlightening to me, and hope for anybody in this profession who sees himself as a healer, no matter really where they are in the journey. And I know some people, sorry for you guys, might be disappointed that we didn't really get into any of the nitty-gritty of the details about mold or Lyme or, or SIRS or anything like that. Maybe we can have you back if you really want to get into the nitty-gritty biochemistry. But I've really enjoyed this conversation tremendously, and at least give you some time here to perhaps share with people. I know you've mentioned it a couple of times throughout our conversation now, your new book, and because there's a wealth of just wonderful information in there. I mean, I've truly blessed to have read it so far, and there's some really wonderful sections, but wanted to give you an opportunity to share with people perhaps other conversations that you've had that you could direct them to, or ways to be able to get the book and follow your work.
Sure. First, the book is called Toxic: Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivity, and Other Chronic Environmental Illness. Sorry for the long title. But it's not all mine. When you write a book, your publisher has input into the title. So I will leave it at that. It's available on Amazon either as a paperback or as a Kindle. And it's available from all other Kindle sources and booksellers everywhere. So it should be easy to get hold of. There's a number of many podcasts or interviews with me going on these days. One of the better ones is with my friend Scott Forsgren, who your listeners may know as the Better Health Guy.
Yes.
So he's got a wonderful website, thebetterhealthguy.com, in which he's interviewed a whole lot of people in the integrative medical world. I did a very recent one with Scott, which I think will delve into some of these nitty-gritties for you. Go to my website for more information. I did a whole bunch of podcasts when I had a weekly radio program, Voice of America, with a lot of the well-known people referred to in my book. We've got podcasts with Joe Brewer, Richie Shoemaker, Larry Afrin, and so on. So there's a wealth of resources for listeners, and I hope they'll take avail of it. And if you have a loved one or you yourself is wrestling with complicated medical problems and you can't figure it out, my book was written for you. So I really encourage you to read it, and I hope it will be helpful.
Yes, I'll have all of those, links to those things on our podcast page, and I would second that again. Really, this book is tremendous. The scope of which, the scope of the questions you're seeking to ask and answer in this book is really profound, and you really are trying to help both that patient and the healer. So there is something in there for everyone in this complicated, complex space. And so, Neil, thank you for sharing some of this time. It's really an honor to get to talk to you and to see this book. I mean, I'm at such a young age wanting to go into this integrative medicine space. I'm really grateful to have this book and this resource for so many reasons. So thank you for doing this for me.
And a quick one, let me recommend that you look into ISEAI, ISEAI, which is a newly formed organization to certify physicians in these issues. And their first meeting will be this coming May. And I really think, Rob, that's right up your alley in terms of some of the information you're looking for.
That's wonderful. Always seeking. I think that's another place to go. So
sorry, Rob, you are a seeker. You're going to be doing this for a really long time.
Yeah, maybe I'll keep the beard and look as good as yours. So,
if you're accusing me of role modeling after me, I don't know quite what to do with that.
Awesome, man. Well, Neil, thank you again. I can't wait to. I'm sure our paths will be able to cross in person at some point. So, thank you for doing this.
I've actually enjoyed this conversation, Rob. Take care.
It's been over 18 months since our first blog and podcast at A Medicinal Mind. In those 18 months, we have covered some tremendous ground, holding conversations with some of the most visionary and inspiring people in the integrative wellness, mindfulness, and holistic healing communities. Being now this month of Thanksgiving, I can't help but feel grateful for the opportunity to share in this creative dance, this exploration into human connection and the human experience. I also can't help but thank you all for listening, for coming along on this unexpected journey, seeking yourselves to be filled up by faith, love, wholeness, and compassion. All of us at A Medicinal Mind thank you for your support, your presence, and your individual service, for together we are one collective servant, making healing, connection, and love all possible.
Thank you for your presence and willingness to receive a new narrative, a passionate perspective, and perhaps a deeper sense of connection with our collective purpose. Please share this podcast with any and all that you believe will benefit from its intention to relieve one's doing and engage one's being. Please share your comments about the conversation on our podcast page and leave a review in iTunes so that the voices in this space can spread to all ears ready to receive it. Music credit goes to Dillingham for their song Vessel. Remain open, stay curious, and forever be love.
You walked on fire, and I know you tried.